All right. Well, good morning, everyone. We're gonna get started. We're still expecting some more people, but they'll wander in. I do want to get started because I want to just sort of keep us on track. We have an ambitious day ahead of us, and I hope we're going to get a lot done. So, welcome, everyone. I'm Jordan Feld. I'm a hepatologist and researcher in the hepatitis C field for a while, based here in Toronto. Welcome to Toronto. I hope some of you are going to be staying for the Global Hepatitis Summit that's coming in the next few days and should be an exciting international event here. But today is really meant to be a workshop on an effort that we started a number of months ago to develop what we have called a blueprint to inform an HCV elimination strategy in Canada. And I'm just going to give a brief introduction to the day, and then we'll get to the meat of things. Before I start, I would like to acknowledge the traditional custodians of the land we're on today, the Wendat, the Anishinaabe, the Haudenosaunee. Thank you. I'm sorry, I apologize for that. The Mississaugas of the New Credit First Nation and the Métis Nation, and express our gratitude to the community and elders past and present. I would also very much like to acknowledge our many partners in this effort. So I will explain that as this is an effort led by the CanHepC Research Network, but we have many partners that have been involved in this, and I really do want to thank them for their contributions. I think they're all listed here, but there may be others as well. And in an ongoing effort, this really is a collaborative, or intended to be a collaborative effort. So, what are we trying to do? I don't think for most of you in this room I need to give any context to have the problem of hepatitis C. We think we have somewhere between 250,000 people and maybe upwards of 300,000 people infected, a low diagnosis rate, and an even lower rate of those who have received treatment. There are some populations where hepatitis C is a greater burden, so with being overrepresented among those infected. And when we look around the country, we see that although there's a lot of excellent work being done on many fronts of hepatitis C care and management, it's a bit fragmented, and there is not a lot of sort of national effort to do this together. So who is CanHepC? Most of you are probably familiar with this, but this is the Canadian Network on Hepatitis C, which is a network funded by the Canadian Institutes for Health Research and the Public Health Agency of Canada. And it is a research network comprised of 62 investigators, 26 trainees, 10 knowledge users, and it does comprise a bunch of different areas. So there are 4 scientific pillars: the basic science, clinical, epidemiology, and policy cores, and then 2 additional important cores: the knowledge translation and training and mentorship core. And collectively, we're trying to do research, training new people to take on sort of the torch of research in this area, and then also make sure that all of the research that is done in the CanHepC network is passed on and actually leads to some change in science and policy in Canada. So, with this sort of in background, and the reason that CanHepC has taken this on is we felt that as an organization that represents really a fairly broad constituency of Canada of people interested in hepatitis C, we're in a reasonable position, if anyone is, to sort of make an effort to try to do a national drive towards elimination. So why are we even talking about this? We all know that major changes have happened in the hepatitis C field in the last few years with major improvements in treatment. Diagnostics are getting simpler, benefits in prevention strategies, and really some people often ask me, well, what are you going to do now that Hep C is done? And of course, Hep C is not anywhere close to done. This is really, if anything, it might be the end of the beginning, but it's definitely not the beginning of the end. We have a lot of work to do, and it's really just having these tools that allows us to start thinking about really grandiose ideas like elimination. So the World Health Organization has really taken the lead here, setting their elimination target, and remember that they're not trying to eradicate this infection, but trying to eliminate it as a public health threat by the year 2030. And the goals that they've set out are a reduction of 90% of new infections and 65% reduction in mortality from viral hepatitis by that year. Now, importantly, Canada has signed on to this. This was one of the relatively early acts of Jane Philpott as Minister of Health to sign on to commit to these goals. But in order to do this, the World Health Organization has asked every country to develop a national action plan of some sort or another to try to facilitate the move towards these elimination targets. And I think that we are going to need some type of comprehensive coordinated effort encompassing prevention, screening and diagnosis, linkage to care and treatment, and then prevention of reinfection. And if we don't do this, it's very unlikely that we're going to reach these targets. So the question that's often asked is, why doesn't Canada already have a national action plan? We're a country that prides ourselves in generally having a very good healthcare system, but there are some challenges. And the most important reason, and it's something that's important to think about today as we're working through this effort, is that there are some challenging jurisdictional issues in terms of coming up with health policy in Canada. Healthcare is a provincial and territorial matter, and that means that there's no federal mandate to impose a plan on the provinces and territories. And we have to remember that as we try to make some guidance about how to move towards elimination. I would also say that our prior federal government was pretty opposed to really addressing hepatitis C particularly, but there are some other considerations. One is the idea of having disease-specific versus a syndemic, or thinking about multiple related diseases together, and there's pros and cons to both. I'm not going to spend a lot of time on that now. And of course, there's other major health priorities, and any time we focus our efforts on one, it may mean that we're taking away efforts from another. So importantly, the Public Health Agency of Canada has shown some important leadership in this area, and they are stewarding the development of what they have called an integrated framework for action for sexually transmitted and bloodborne infections. And they've devised this with 4 pillars focused on prevention, testing, care and treatment, and ongoing care and support. And an initial draft of this was circulated about a year ago. And to their credit, I think they got a lot of feedback and really did a very nice job on revising what they had worked on. This is not a simple process, and when you ask for feedback, they got some feedback, but they did really take that to heart. And there is another draft document that has not yet been approved, but I can say that the draft document is really much improved and really an excellent effort to put together what they're trying to do. Now, importantly, they have taken a syndemic approach. So they are really trying to recognize the fact that a lot of the sexually transmitted and bloodborne infections have a lot of overlapping or intersectionality, and that should be considered when you're trying to develop an approach to addressing them. So they've tried to make recommendations that are relevant to all of the STBBIs. They have had a very inclusive process. They've reached out to key stakeholders, affected populations, clinicians, researchers, policymakers, and to the provinces and territories to get feedback. And they're hoping to have this document approved by the provinces and territories by later this year. So then you could say, well, they've already done this. Why are we here? What are we trying to do? And so I would say that I think most of us in the hepatitis C world feel that there are certainly some common elements across the STBBIs, but there are also some key differences. There are some unique aspects to hepatitis C. I've mentioned just a few. One is that it's curable and that we now have broad access to therapy. We do have this problem of a low diagnosis rate, which isn't unique to hep C, but it's a major challenge. And then we have a significant ongoing issue of rising morbidity and mortality. So we really have to do something now because there is a lot, the problem is right in front of us. And I would also say that when you think about a syndemic approach, one of the challenges is that it's hard to be specific. So it's hard to develop implementation aspects to that. You get sort of the 30,000-foot view without some of the details. Now, there is a plan to have an implementation strategy that goes along with the STBBI framework, which PHAC is developing, and I think that will be helpful. And we've had some good collaborative discussion with them about what we're trying to do, and that hopefully our efforts will help inform that implementation piece. So what are we trying to do? So we'd like to provide guidance, and I really stress the word guidance, because this is not meant to be prescriptive. This is not meant to say this is how you have to do elimination in your province and territory, but this should provide you some guidance on how to address hepatitis C and to try to give some specific and measurable objectives to achieve elimination in the Canadian context and within the context of each province and territory. So with what we hope to provide, this should then allow the provinces and territories to adapt it to their own specific context. And so I guess I think about this is the what you need to get done, but how you choose to do it is something that each province and territory needs to figure out on their own. So that's why we've termed this a blueprint and not a national action plan. So it's sort of I guess I kind of think about it as this is a menu of things. Here are some things that you really need to get done, and here are a menu of choices that you can use to get to those goals. So we've tried to align this with the WHO specific hepatitis C elimination targets using the manual that they've put out, which is really an excellent document. And we really have made every effort to make this complementary to the PHAC STBBI framework. So this is not meant meant to replace it. It is not meant to upstage it in any way. It is meant to really sort of fit right into it and hopefully be something that helps establish what they're aiming for. So the way we've done this is we've really looked across the Can Hep C network, which really does have a wealth of knowledge and experience, and brought in expertise from across the country to develop working groups, which includes Can Hep C researchers, community organizations with wide representation, including affected populations, clinicians, healthcare workers, and many others. And we've asked all of the working groups, if they look around their group and feel that there's specific expertise which is lacking, to please reach out to people who are not formally in Can Hep C or in any of the other networks and bring them into the working group. We really do want this to be an inclusive effort and make sure that we have the expertise in the room to get done what we want to do. We have hired a consultant writer who is in the back, Tracy Swan, who is here to help put together our final product as a cohesive document. When we have different working groups working together, we don't want to have a piecemeal final document. And so Tracy has a lot of experience working in the Hep C field and also in other STBBIs and can really add some also knowledge as well as bringing together the document. So the process is that we've changed slightly in our alignment with the PHAC framework. So we have 3 working groups: the prevention, testing, care, and treatment, which are going to develop specific recommendations. And then a key other working group is the priority populations working group. And you can see the priority populations highlighted here. And the 4th pillar that PHAC had identified, ongoing care and support, we actually felt that that might be better to be divided between 2 other pillars. So for prevention, that includes harm reduction to prevent reinfection, and the care and treatment group will also work on ongoing management and support post-cure, which was really what they had outlined in the STBBI framework. So each working group has been asked to identify objectives with specific targets to achieve that they need to achieve. For each target, they've been asked to come up with specific activities, and then as much as possible to try to make this an evidence-based effort, to support it where there is evidence, but also to make sure that we're not paralyzed by lack of evidence. So where we don't know exactly what the best thing is, we still want to make recommendations. We don't necessarily want to wait the years it may take to generate high-quality evidence in some efforts. So you'll see that each of the documents that are currently in draft form and are going to be presented today will have a brief background, which is really focused on the current situation in Canada and just on Hep C. So the PHAC framework is on all STBBIs. This is just on Hep C. The objectives are very high level. So for example, they might be something like reduce incidence in Canada. So these are really the big picture aims that you're trying to get to. But then we have specific targets for each of these objectives, which should be measurable. So for example, reduce new infections by 50% by 2020 and by 90% by 2030. So you have the big objective, the more defined targets. Indicators, because if you're going to measure something, we need to know how to measure it. So we've given some guidance on how to measure these things, again, taking this largely from the World Health Organization. We've then had suggested activities, and I really highlight these are suggested activities. So the provinces and territories don't necessarily need to do all of these things. They may choose one or more of the activities which will be relevant in their context to try to achieve the specific goals, sort of like I said, a menu to choose from. And then what we've asked our priority populations working group to do is to frame the situation, but then also to give feedback on each of the draft documents from the lens of the different priority populations to make sure that we've considered their specific needs in the document. So what's today? Well, we're going to present draft documents. So we've been working with conference calls every 2 weeks and a lot of behind-the-scenes efforts by each of the working groups putting together draft documents. And I really do want to thank all of you for the hard work that you've done, particularly to the leads of each group, but also to all of the members of the working group. It's, I think, a testament to how important people feel about this is our calls have been very well attended. We've really had and a lot of engagement from around the country, which is nice to see. We really are looking to get feedback and guidance on from what we've been doing. So the working groups are here, but we've opened this session to the public broadly. We announced it, and people could register for this. The session today will be recorded, so for people that weren't able to attend in person today, it will be recorded and available to them. For people who are presenting, just as an FYI, it's important that you speak into the microphone because that's how they're recording it, and the camera's at the back. Importantly, industry is invited as a stakeholder, but I do want to emphasize that no funding for today or for any efforts of developing this blueprint have been received from industry, but we did feel that they should be in the room and be able to provide feedback and guidance today for this morning's session. And then the working groups are going to work this afternoon to try to take the feedback that we get and improve the drafts that we have. So I guess I think about it this morning, we're really listening, and this afternoon we're going to roll up our sleeves and try to get to work and try to get pretty close to a complete draft that we can then circulate for feedback beyond today. So the way the day is going to go is that each of the groups is going to present for 15 to 20 minutes, and then we have tried to have a fairly good chunk of time for discussion, so around a half an hour after each presentation. So I'll ask the speakers to try to stay close to time and then give us the time for discussion. The priority population is going to start, then we're going to go through prevention, testing, care, and treatment, and then this afternoon we will break out into our respective groups. After today, what happens next? On Friday evening, as part of the Global Hepatitis Summit, we will be presenting the revised draft documents. So whatever is revised after today's effort will be presented in a session which will be held from 6 to 7:30 here in this building. It's in room 715, so it's just down the hall. Importantly, the Global Hepatitis Summit, unfortunately, as much as we would have liked to have made it open to the public completely, we could not afford to do that, so there is a charge. But if anyone would like to attend this session, it is free and open to the public. It will be the meeting will be open from 5:30 and onwards, so please spread that within your networks if people would like to attend. And we'll present the revised draft documents, and then we will have a panel discussion, and we're lucky to have 4 really international experts from different countries around the world that have been very involved in developing national action plans and strategies in their own respective countries and really given a lot of thought of how to do this and do it well. So we're going to get feedback from Sharon Hutchison from Scotland, John Ward, who led the effort at the US CDC for many years, Manal Al-Sayed from Egypt, and Greg Dorr from Australia, and get some feedback from them on what we're doing and some input on our efforts to date. We will then be circulating these draft documents over the summer and into the early fall to get feedback from people who could not provide it today or this week. And then we're aiming to try to have a final document blueprint for the fall of later this year, ideally to be released in concert with the PHAC STBBI framework, and we hope that this will really be a nice thing to put together. So if you do want to provide feedback beyond today, or you don't feel like doing it in a public forum, you can either contact us at this email address here, or you can go on the CanHepC website, and we'll make these available to you later as well. I will briefly take questions, but I would focus them on either what's happening today or if there's a big question about the process, but I want to get to the meat of the presentations. Are there any quick questions? Good.